Kimberly, are you ready to go? Okay, then we're good here.
Good morning, everyone. My name is Kimberly Wood. I am one of the co-chairs of MLAC, and we wanted to thank you all for coming today. I realized after the last meeting that I really never introduced myself, so I apologize for that. Hope to remedy that today. I see that there's several people on, we've actually got 44 on the line already. I did see that there were some people who were not muted, so just remind you to please mute yourself if you are not the one that is that we're taking testimony from. There's a lot of testimony, a lot of folks want to talk today, so we're going to have to move this along pretty quick. We're going to try to limit it to 10 minutes a person so that we can maybe try to get through everybody and then try to have no more than 2 minutes worth of questions. I suppose there might be instances where we're going to deviate from the questions, but we're going to pretty much try to keep everybody on track with 10 minutes of testimony. I know this is an important issue to everybody, and I know that the other committee members and myself are very committed to finding out whether there are issues with the workers' comp system with respect to COVID-19 claims or cases, and we ask your patience. This is we've got a lot to do in a very short period of time, and we'd like to do this in a very orderly manner so that we maximize all of your time as well as our own. So today we're going to be talking about the issues. I know we've got quite a few people lined up. We're going to ask that you focus on the issues that you're seeing with the claims and not the solutions. We are going to have some time in the coming weeks to talk about solutions, but we are going to ask that you refrain from talking about the solutions today. We promise that there'll be an opportunity to do that. It's just not today, so that we can get through all the testimony and make sure that we're able to vet all of the issues before we start looking at the solutions. So we ask your help in that today. Committee members, I think this is going to be a little bit different than the last one. We only had a couple of people testifying, so I'm going to ask the committee members that are on today, if you have your video on, that's great. Raise your hand if you've got a question, and then I will call on you. And before we move forward to the next topic, we'll make sure that those committee members who are on the phone have an opportunity to ask questions as well. So try to get everybody in there, but I think that might be necessary today because I have a feeling there's going to be a lot of information, a lot of questions. So I hope to make that a little bit more orderly. And with that, do you want to do a roll call, Teresa?
Yes, I can do that. So I've got, I see Diana, I see you, Kimberly, Tammy?
Here.
Good morning. Alan? Lynn?
I'm here.
Good morning. Kathy?
I'm here.
Hi, good morning. Let's see, and Kevin, I saw you earlier, so I've got you.
Good morning.
Good morning. Jill?
I am here.
Good morning. And Atusa?
Here.
Good morning. Okay, we'll get to it.
Great. Before we move on to testimony, I just wanted to bring everybody's attention. Sally sent us some additional data on COVID claims. Sally, I wanted to say thank you so much. Her picture disappeared, but she was here. Thank you so much for that. Really, for me, seeing them broken down into much more detail was super helpful, and also the differences between the types of insurers. So I felt that this information was really helpful. I think we're still looking for more, but this was a great start, and I really appreciate what you guys did in such a short period of time. So thank you. Sally, your mic's not on.
She's muted.
No, still not on.
Can you unmute, Sally?
Yep.
There you go.
How about now?
Yes.
Yeah.
I was about ready to
Sorry.
unmute you, Sally. Sorry.
Yeah. We'll keep working on the additional data, Kimberly, too, but we were hoping this would be helpful for you, and we can keep doing this.
It really was very helpful to see it broken down into a little bit more granular data. That was helpful for me. I hope the other committee members felt the same. So thank you guys for doing that. We look forward to some more data coming from you. Okay.
You bet.
Well, I think I don't think I have any more administrative things. Diana, is there anything more that you want to add before we get going? Can't hear you. It shows that the speaker's on. I'm wondering if they've muted you by accident. Is Diana muted?
No, I have to scroll through every. There's
No,
like
she's not.
she's not.
No, can't hear you yet. And she's got Microsoft account, not her name, is what it says on her
Oh, that's
on her
right.
thing
Yep,
down.
yep. I'm muted here, so
Okay, well, no, we can't hear you. So I think you're having difficulties. We'll hopefully catch up with you in a bit.
yeah. Or Diana, if you want to add things to the course of the meeting, you can always use the chat function as well. So we'll have that running.
Okay, so I think we're going to move on to some testimony. The first person that we're going to hear from this morning is David, and I'm going to apologize if I say the name wrong, but Worms, I hope is the way you pronounce your last name. David, are you here this morning?
Yes, I'm here. Hi.
Wonderful. Did I pronounce your last name correctly?
You did, yes.
Oh, great. Well, thank you for coming today. We appreciate it, and we'll give you the floor.
Okay, great. So my name is David Worms, and I live in Portland, Oregon. I'm a carpenter and had worked at my last construction job from June 2019 until my recent termination. And I'm here to speak to the agenda item having to do with educating workers about workplace safety.
Okay.
So throughout my time at the company prior to COVID-19, I had witnessed ongoing issues related to worker safety, particularly with the use and supply of construction-related personal protective equipment. Although they had access to proper PPE, they did not enforce the use of it. They left it up to the individual employees to find it if they wanted to use it, and even then, some may not have been available. So in the early onset of COVID-19, I made sure to educate myself by listening to guidelines from the CDC and the state. I also have family living in Europe who were dealing with the outbreak before ours to understand what they were experiencing and how they were responding. I knew the outbreak here was inevitable unless safety precautions were taken seriously. I had brought my concerns about workplace safety to my supervisors and management many times. The only noticeable action they took is a text message asking people to stay home when they were sick. However, they took no action to follow up and allowed sick employees, of which there were many, to return to work unchecked. The work site was often overly crowded, with our team as well as several subcontractors and their crews working in close proximity. No one wore masks and were not required to do so, and there were no hand sanitizing stations. There were also no efforts made to perform the work while adhering to social distancing practices, even when the nature of the work permitted it. It seemed no one cared that we could be spreading a dangerous disease. Throughout this whole time, it was clear the main focus of the company was to complete the job by the deadline of the project and not for the safety of its employees. When Governor Brown came out with her new guidelines for businesses to operate under COVID-19, I immediately provided the information to the ownership and volunteered to help with workplace safety changes on site. My request was met with silence. Given my exposure to these conditions and my contact with people who seem to be showing symptoms of COVID-19, as well as having compromised individuals in my home, I thought it would be best to self-isolate for my own protection as well as others. It was my understanding that companies were required to provide up to 40 hours of additional sick leave for this purpose. Upon my request for additional sick time and sending management and ownership the requirements issued by Governor Brown, I was terminated for what the company stated were financial reasons. However, less than a week later, I was notified that the company posted on a job site that it was hiring between 5 and 10 new employees with a job description near identical to my own. If I was terminated for financial reasons, then how should they afford those new positions? I tell you this story because I think you need to hear it to discuss how situations like this have become a norm with the current situation, and it's not right. I tried to do the right thing and asked the company to do more to protect its workers, which shouldn't be a terminable offense, but it was and will be for other Oregonians. I understand that businesses are dealing with new challenges, but this doesn't mean that the lives and well-being of employees should bear the burden and risk alone. Realistically, the requests for safety precautions related to COVID-19 are not tall orders or financial burden to employers. They just require that employers treat their employees humanely and with respect. That's the only way we will get through this together, while ensuring that employees are not punished for doing the right thing or for simply trying to make a living. That was all I had to say, and thanks for the time.
David, we want to thank you for coming today and testifying. We really appreciate hearing what you have to share with us. Does anyone have any questions? Hands raised.
I don't know how to raise my hand in this newfangled technology. I'm too old to.
Kathy.
Oh, this way, the old-fashioned way. I thought you had to push a button on the iPhone. David, thank you so much, and it pains me to hear your story. I do have a question. I was wondering if you were aware that you could or can file a complaint to Oregon OSHA anonymously for help. And did you do that? I was just curious.
Sure. I had actually done that. And at the time, I was told by OSHA that they currently had multiple complaints from other people regarding their companies, and that with construction-related issues, or the construction industry, at that point at least, they weren't investigating any issues. At that point, they were saying that since many of the tasks require you to be in close proximity with others, they were just mostly ignoring it.
Shame on us. I'm sorry about that. I'm really sorry about that.
Oh, it's okay.
When you said that they were ignoring it, did you mean that the employers were ignoring it, or OSHA was ignoring it?
Well, I had spoken to a representative from OSHA, via a phone conversation, and they said at that time they weren't really investigating these cases or these instances.
Okay, thank you. Does anybody else have any questions? And then I'm going to move to talking to the folks or our committee members on the phone if we don't have anybody else that I can see. Oh, Atusa, go ahead.
Yes, David, do you know if any of your coworkers tried to file compensation claims for becoming ill, or if it felt like there was kind of a chilling, like there was really a disincentive to your coworkers to do that?
Honestly, I couldn't really speak for anybody else. After my termination, I didn't keep into close contact with anybody, other than one individual I know of who chose not to pursue any issues, and he actually moved out of state not too long ago. Yeah, I couldn't say specifically if anybody else who was terminated during that time filed for any kind of compensation.
Okay, just wanted to check if any of the committee members, I know that both Kevin and Jill are on the phone, and just wanted to make sure that you guys had an opportunity as well to ask questions if you had any.
Thank you, Kim. I don't have any questions.
Thanks, Kevin.
Thank you. Not this time.
Kimberly,
Okay, thank you.
I have 1 second. So David, is it possible, if, I have a question in regards to your OSHA complaint. If it's possible, if you can email me, I'd like to follow up with you after the meeting and talk further about the complaint.
Yeah, sure, that would be fine.
Okay, great. Thank you.
Uh-huh.
David, thank you so much. We really appreciate it. We know sometimes it's a little uncomfortable to come talk in front of a bunch of people, but we really appreciate your input today and the time that you took to come talk with us. Thank you.
Oh, you're very welcome. Thank you.
Yes. Next up, we have Jay Pinkerton. Is Jay available this morning?
Yes, I'm here. Good morning.
Great. Thank you. Thank you for coming today. Please go ahead.
Members of this committee, my name is Jay Pinkerton, and I've worked as a police officer since 1995. I'm currently serving the role of senior officer in my department. My regular duties at the beginning of this year were to act as a patrol officer. It means that I would check into my car, go on patrol, and respond to the various calls that come in over the radio. This meant that if there was a motor vehicle crash or accident, I covered the motor vehicle crash. If there was a domestic disturbance, I responded to the domestic disturbance. If there were homeless people blocking the pedestrian bridge, I responded to that. My wife has a compromised immune system, and in order to protect her, I do everything I can to avoid getting sick with COVID-19. Our shopping used to be online, so where I would schedule it and go and pick up, so we never had to go into the store. But after the pandemic became a larger problem, it became very difficult to schedule time to pick up groceries and other items. So we do our shopping late at night with very few people around. Our children are homeschooled, thus reducing the risk of exposure through them. In late March, I began feeling ill with many of the symptoms that are reported as being potentially COVID-19 symptoms. I went in and got tested. The first test was done incorrectly, but the second test showed positive for COVID-19. I filed a workers' compensation claim, and it was denied. I was given 80 hours of sick time to cover my recovery, but I was forced to use that before I ever came back to work. Since that time, then I've had to burn my own time as I've tried to recover, and I've also had to cover the costs of tests, medications, and doctor visits personally. As a consequence of my denial, I am forced to use my own sick time leave in order to maintain a reasonable cash flow for my household. In order to get my medical care paid for, I at present use my group health care insurance, and I am liable to pay all co-pays and deductibles. Unless this claim is accepted, if I have long-term health effects that arise from COVID-19, they will not be covered except through my group health or other insurance. If I have permanent limitations on me, I will not be compensated for those in any way. Everyday workers are putting themselves at risk on the front lines, and those of us serving our community deserve certainty that they will be covered if they get sick on the job. And I urge you to do what is in your power to fight to protect them. Thank you.
Jay, thank you so much for coming this morning and sharing your story with us. I'm going to ask the committee members if anybody has any questions, raise your hand. Lynn?
Jay, thank you for your testimony. I just wanted to know what police agency you're with.
I prefer not to mention that right now. I was instructed not to identify where I work as, because then it could be a conflict with my employer that I am representing them.
Okay, thank you.
Tammy?
Jay, do you have an attorney? Have you appealed your denial?
Yes, I have, and I'm going through the long process now, and hopefully there'll be a positive outcome at the end.
Jay, I'm wondering if you're comfortable sharing with us, and I don't know if this is appropriate. If it's not, somebody shake your head no really quick. I know that you would have gotten a denial letter, and I'm wondering if you would be able to share with us the basis for the denial. Is that okay? Anybody thinking I shouldn't ask that? Is that it? Okay. Nobody's telling me I shouldn't, so I'm going to ask and see whether or not you'll answer.
Yeah, I'm trying to think how best to go about this. So basically what happened is I got sick. I went on my own and got tested. And then when I got the positive, I had to go through the whole process. Paperwork was, so I'd already taken some time off from work, sick time. As soon as I started feeling ill, I took time off from work. My wife locked me in a room and wouldn't let me leave, and segregated herself to protect the family. And so then I filled out the paperwork through work. It started the clean process. when I was asked to give an interview, I said that I wanted to have representation because all this stuff was new to me. And then eventually what ended up happening is before any interview was done, I got a denial letter saying that my claim had been denied. And so now I have an attorney that's working with me, and we have they're going to do some more stuff coming up here. So I haven't had any hearings yet. I haven't had my chance to basically tell my story. And so that's kind of where that's at.
Okay. Go ahead.
So Jay, I have a question. Did your employer at all address for you or any of your coworkers, if you were to become ill, that there was a process to file like a claim through workers' comp, or that it might be employment related? I don't want to editorialize. I know I myself work in a hospital, and our hospital didn't have a process for that until we pushed for that. So.
Yeah, I mean, there was a process with anything, like any kind of injury. We have a set process of how you document it. So like exposures, I had documented exposures, but the issue comes into being able to prove specifically that person had, that I had exposure with, that was sick, that they actually had the COVID-19. So if it comes down to being able to prove that they had it. And so you kind of get left out on your own to a certain extent. So you document these instances, the contacts you had, and then when you file the paperwork, there's really not much after that goes on. You kind of, I don't know, I kind of felt like they supported me to a certain extent, but at the same time, you're kind of on your own in this big, massive sea of paperwork. Did that answer your question, or did I go?
No, it does. Thank you.
I know that I see Diana would like to ask a question, and we'll see if we can hear her.
Can you hear me?
Yes, we can.
I can.
Yay! So we're gonna dual mobile device this. I just wanted to ask Jay 2 questions. I was just curious on average how many people you interact with on a daily basis, especially in light of the fact that people who may be carriers of COVID-19 may not possess any symptoms. And I was also curious as to your insurer, if you don't mind sharing that, or at least whether your organization is self-insured or if you have a different carrier. Thank you.
It's funny that it kind of ebbs and flows on how busy things are, but the people that I usually come in contact with are a lot of people that don't really care about their personal hygiene or social distancing or anything like that. So I work for a very busy agency, so I come in contact with a large number of people throughout the day. I don't want to try and give you a hard number of that, but I mean, it could be 10 different people, it could be 20 different people, but I deal with a large number of people. Obviously, I tried to minimize that once all this stuff started, whereas I would try not to do traffic stops or do other things that would bring me in close proximity of people that were unknown quantities. As far as my insurance provider, we go through Corvell, but I think we're self-insured, and then Corvell is the manager of that, but I don't know much about that how things work.
I see that Kevin had a question. So Kevin, do you want to take the floor?
Yes, thank you very much, Kimberly. So my question really is, you have a very stressful job as a first responder. We understand that. Obviously, you're going through the COVID-19 situation even before you had it, extra stress. Also, your home situation causes stress. And I'm just wondering, then getting a denial letter, did that really make a difference in the stress in your life? How did that impact your recovery and your ability to take care of yourself?
Yeah, I'm trying not to get personal about this, but or emotional. It was devastating, to be honest, because you go out there with the mindset that people are going to support you and that you're going to be taken care of, that if you put yourself out there in harm's way, that you're going to have people that are going to take care of you, take care of your family, everything else behind you. And my leaders in the department, everything else supported me, from the chief on down, they cared for me. But getting that denial letter it hurt. I mean, it truly did. You felt kind of left behind, lost, that your value was lessened. And that's at least personally how I took it. But it was hard after doing this job for as long as I have to come to that realization that I have to look out for myself kind of thing and worry about the back end as well as what I'm dealing with in the immediate moment.
Kimberly, if I may.
Yes.
I just wanted to say thank you for answering that question. I know it's difficult, but I think it was important for us to hear on an individual basis how this is really affecting people going through this process and how we can make it a better process to cause less of that stress on people's lives.
Thank you.
Does any other committee members have any questions? I guess I forgot to be watching my time, so I'm sorry. Bill, did you have any questions?
No, it's fine.
Thank you. Okay. We're going to move on to our next individual, who's Meghan Herring. I'm hoping I'm saying that correctly. Meghan, are you with us today?
I am. Good morning.
Great. How do we say your last name correctly?
It's Herring.
Herring. Okay, thank you. Please go ahead.
All right. Good morning, members of the committee. My name is Meghan Herring, and I live in Hood River. I've worked as a nurse for 9 years, having been at my current hospital job for the last 3.5 of them. I work in the delivery room, where my duties include labor and delivery, patient triage, and postpartum recovery. In the early stages of the COVID-19 outbreak, I continued to find myself surprised by the lack of safety protocols in place at the hospital. We knew the virus was out there, but no one was being tested. The lack of testing meant no one knew if anyone we were working with or caring for had the virus. Throughout this time, early to mid-March, we still had no access to masks. On March 16th, I came down with a sore throat. At that point, the only thing the hospital was doing was having employees fill out a questionnaire with their symptoms. If we felt we were sick or had concerns, we were told to call employee health. I called employee health after filling out the survey to explain my symptoms and ask if I should be tested. Their response was to tell me I should come into work for my next scheduled shift. I went to work my next 2 scheduled shifts that week. I'm a per diem nurse, so I only come in a few days a week. On March 26th, we had finally gotten around to fitting staff for N95 masks we could wear on our shifts. We were told to use them only for patients suspected to have COVID-19 and to use these N95s until it was unusable or we were unable to breathe through it due to lack of mask availability. That day, I also came down with a fever. I followed up with employee health as that was the protocol, but got no answer and decided to go home. As my illness progressed, I was desperate to get tested. I finally heard back from employee health on March 29th, saying that I did not meet the qualifications to get a test. I set up a telemedicine visit with the hospital doctor to see if I could get approved to get tested. She told me my best option was to go to Seattle for a drive-through testing site. Being a mother in Hood River, this was not an option for me. After repeated attempts to get any answers or a test through the hospital and employee health, I decided to take my own action and set up a visit with my primary care doctor. I was tested and it came back positive for COVID-19. After my positive test, I faced major concerns about who I may have been in contact with throughout my inspection, including family and patients. My family and I took safety seriously throughout this whole pandemic. My kids and husband have been home since March, and we have worked to drastically limit visits outside the house. No one has been sick in my home, so I know I did not get it here. With my positive diagnosis, I checked in with my manager to see what my options were. She, my manager, had been my advocate the whole way. She told me the next step was to file a leave of absence. All I asked for is that my days I missed due to the illness were paid for. It was actually suggested to me by a doctor that works for both the hospital and the county health department that I submit a workers' comp leave of absence claim as opposed to the standard leave. The request was quickly denied as they told me I could not prove exposure on the job. While I was shocked I had my very reasonable request denied, I was not surprised that they could not prove exposure. As I mentioned before, there was no testing being done on employees or patients, so tracing it back to the workplace was impossible. A workers' comp claim has been denied. Why? I can't prove the disease was contracted at work. At the hospital, 11 nurses ended up submitting claims for COVID-19. All 11 of those claims have been denied. I come to you today to tell my story to fix this injustice. The workers' comp system is here to help employees recover our lost wages and get medical bills reimbursed. However, in this case, it let me down. While I may never be able to prove beyond a doubt where or when I got sick, everything points towards the workplace. The day after my positive test, the hospital finally instituted testing and safety protocols to protect staff and patients. This included us being required to wear a basic mask at all times. While I applaud their effort to respond to this failure, I feel it should never have come to this. Frontline workers, including healthcare employees, deserve better. That's it.
Megan, thank you so much for testifying today. I think all the committee members are really appreciative that you came forward and shared your story today. Do any of the committee members have any questions? Kathy? Or Tammy, excuse me. Tammy.
Yeah. Megan, did you appeal your denial? Do you have an attorney? Are you appealing your denial?
I do have an attorney, and we are working on the appeal right now, yes.
Okay, very good. Thank you.
Yes.
Do any of the committee members have any questions? And then I'll go ahead, Tammy.
Can I ask one more? I'm sorry. So the 11 other claims that were denied, were they early on like yours, or were they after the April and May? I know there was a lot of failures in March nationwide. And so I'm just wondering about the other 11 claims. Do you have any information as to, were they early on as well?
I do not know the answer to that question. I'm sorry.
That's okay. I thought you might not. All right. Thank you.
Yeah, thank you.
Megan,
I have a question. Are you able to tell us who your insurer was?
Who's asking the question? I'm sorry.
This is Sue Quinones with City of Portland.
Yeah, we're actually only limiting questions to the committee members, so I appreciate the question, but we're trying to limit that to the committee members. Atusa?
Yeah,
okay,
that was going to be my question, if she knew who I know who her employer is, I believe, but do you know, Megan, who the workers' comp insurance company is?
Would that be Sedgwick?
Yes, thank you so much.
Yeah. Mm-hmm.
I'm wondering, Megan, can you tell me? I know that you had indicated that you had it. I'm just trying to understand a little bit more about the impacts to you. Other than having some time off and clearly probably a very difficult time when you were sick, did you have other complications? And I don't want you to get into all the medical. I'm just wanting to know is your workers' comp claim is there additional medical on top of just the time loss? Is this inappropriate? I don't want to be inappropriate, but I want to just kind of understand if this is a time loss claim that they denied versus was it medical as well?
So for me, I am pursuing it as a time off claim. When I got the original denial, it was for the time off. they mentioned that they would cover the cost of the test that I got through my print. However, that has not been paid yet, and I imagine that may be because we are moving forward with the time off claim. So it's kind of still in limbo.
And Megan, did you also file a claim? I know that they offered to have you, let me see, I want to make sure I have it, say it correctly, but a leave of absence, was that a paid leave of absence through the employer, or is it an unpaid leave of absence through the employer that they had initially asked you to do?
So the initial recommendation was to simply file a leave of absence, and being a per diem nurse, I am not eligible for paid time off through a regular leave.
Okay.
That's what I asked to file. It wasn't until I saw this other doctor who was supposed to give me my clearance to go back to work. He recommended filing it as a workers' comp claim because I am a frontline worker, and he thought that I deserved to be compensated for it.
Okay, thank you so much. Does any other committee members have any questions?
Kimberly, if I may.
Yes.
So my question is kind of the same as for the last speaker, but can you just tell us a little bit on your personal experiences, how this denial, when you received that denial, how that affected, your stress level and how that affected your potential recovery?
Yeah, sure. I'm sure our officer before myself is much more composed because I might get tearful, but it just really felt like a betrayal. Our whole system, because we put ourselves out there and we don't question it. We are willing to work the front lines. We're willing to take those risks. We show up to work regardless of what kind of patients we have, and our hospital system preaches to care for everybody and to make their lives easier and to provide care for all. And going through this process, I feel I had no guidance. I got no guidance from employee health. I got nobody to ease my way. I had, nobody was trying to advocate for me except my manager, who was wonderful. But I spent hours and hours and hours on the phone while I'm sick, trying desperately to figure out, how do I get a test? How do I let my cohorts know that I was sick? How do I let those people know who I worked with, or these patients know that I was sick and that they were exposed? And it just really felt like a huge letdown by my company. Like they just didn't care about us nurses, or, maybe even the patients. Our goal is to care for everybody. They didn't even feel like they would care for their nurses. So it was really emotionally hard.
Kimberly, if I may.
Yes.
Just a quick follow-up. Thank you so much for answering that. And I understand it's hard, but I think it's important for us to hear what's happening. So you came to a point now, you received this denial letter, you realized you needed to get some help. You went out and you sought an attorney and you talked to the attorney. Did that attorney, when you first talked to him or since then, given you any idea how long they suspect the process might take for you to go through the appeal?
I don't know 100%. I do know that I have a court date set as of right now in September for this appeal, and I don't know moving forward how long that's going to continue to take. So,
I want to make sure I heard that correct. A court date in September?
Yes.
Thank you.
You're welcome.
Okay, one more question, and then we got to move forward because we've got a lot of folks today. I don't want to rush, but I do want to try to get as many people in today. So, Diana, go ahead, and then we'll move forward.
I just want to reiterate a thank you to Megan for coming. I know that this is hard because of the fact that you are in the healthcare industry and this situation with this pandemic is so unknown. And I know this is kind of a hard question to answer because it's so unknown, but are you concerned at all that if there is a significant resurgence of the pandemic like we're sort of seeing now, that your employer will again struggle to provide the necessary PPE for you?
So it's really hard for me to answer. You know, as of right now, it seems we have but again, our exposure at this point is you know, limited. So if we see a surge, I just don't know. It's really hard for me to speak to. I'm sorry.
Okay, Megan, thank you so much. We really appreciate you coming and sharing your story with us today. I think we're going to move to our next speaker, who is Anisha Yershak. I hope I said your last name right. I apologize if I didn't. Anisha, are you there?
Thank you for your time. I'm here. Good morning.
Yes. Anisha, could you help me with your last name?
Yes, it's Anisha Yershak.
Thank you. Please go ahead.
Thank you for taking your time and you know, to hear my concerns. My name is Anisha Yershak, and I worked as an on-site medical representative for several years, providing first aid to injured warehouse associates at the Amazon Fulfillment Center in Salem, Oregon. Following the COVID-19 outbreak, I experienced Amazon management try to downplay the risk associated with contracting the virus. By downplaying the risk and not taking swift action to protect worker health and safety, many more people were exposed to the virus. There were at least 2 confirmed cases of COVID-19 at the facility in April 2020. However, I was told that the facility had not been deep cleaned to protect the dozens of associates that were now at risk. In addition, Amazon did not properly inform all of their associates of the virus, various risks of exposure. When I returned to the site after my own medical leave, Amazon assigned me to duties that unnecessarily increased the virus exposure and withheld protective masks from employees. In addition, my supervisor, the safety manager, instructed me to withhold information from sick employees about potential time-off options, so they could keep their job and not come to work ill. The warehouse was desperate for workers so apparently it was more important to have people there, even if they were sick. In fact, one of a very ill employee came in to the warehouse because they could not afford to take unpaid leave, and information was about paid leave benefits had not been disseminated. Similarly, there was no education or information related to workers' compensation due to COVID-19 contraction that was disseminated. In my role as an OMR, I was supposed to provide basic first aid to injured associates. However, in my experience, OMRs receive pressure from supervisors, often supervisors with no formal medical educational background, to make medical decisions outside of their scope of practice and to discourage employees from seeking medical treatment from physicians. I also observed supervisors regularly violate policy by spending time in the medical exam room with injured associates, which had the effect of intimidating associates out of filing workers' comp claims or being candid about the severity of their injuries. Amazon often failed to refer their injured workers to seek outside medical evaluation even prior to COVID-19 pandemic. OMRs were instructed by the safety manager to contact him any time of the day and night as soon as we get a new injury report, especially if we believe that the worker was at risk of seeking outside medical evaluation. That information was required to be chimed out via internal text messaging system to alert all senior and regional management about the event and the nature of the illness or injury. As soon as all stakeholders were notified, the safety manager would personally step in to have a conversation with the treating associate. From what I observed, the safety manager often stated that there is nothing a doctor could do that OMRs couldn't do to help treat the injury. If the worker wanted to see outside doctor, the next step would be to involve senior operations management. Such practice was completely incongruent with Amazon's own written policy. But I suspect there were other informal policies that incentivized this behavior. As a result of the conduct by the safety manager and other senior managers, an associate would either completely close their injury case or sign a witness statement stating that their injury was not sustained at Amazon, and they would like to close their case due to pre-existing medical condition or injury. When I asked how they were planning on using the signed witness statement form, I was told it was done for purposes of fighting any future workman's comp claims by the same associate. I believe that the practice related to workplace injuries prior to COVID-19 demonstrates that Amazon did not want workers to file workman's comp claims. So it is not surprised that the practice carried over past COVID-19. I believe all workers that came in ill should have been screened or interviewed by OMRs in our on-site clinic. One of the screening questions should have been whether the associate believed they were exposed at work to keep full transparency between an employee and employer. OMR should have been instructed to report these cases and offer an opportunity for workers to file a workman's comp claim if they believed that they were exposed at work. None of those measures were taken while I was still employed there. Instead, the company chose to send these associates home on unpaid leave, which had the effect of incentivizing workers to return to work sooner. Of course, some employees were not intimidated out of filing claims. Those that did, however, were not noticeably retaliated against. I observed a number of associates that were fired after filing a workers' comp claim and returning from leave. The terminations, in my observation, were pretextual and retaliation. Associates also observed this pattern, and for that reason alone, associates were afraid to file workman's comp claims or even show up to the on-site clinic out of fear of retaliation. The existing problems with fair administration of the workers' compensation system I described above are even worse during the pandemic. Employers should not be allowed to intimidate workers and prevent them from getting the medical care they need. That's all I have for you.
Thank you very much. Do we have any questions for Anisha? Tammy?
I'll ask it. I'm sorry that this has been going on. Has anybody contacted OSHA? Has any complaints been filed with OSHA?
I believe a lot of workers were trying to contact OSHA to get their attention to their facility as soon as they learned about COVID-19, positive cases of COVID-19 in the warehouse.
Does anyone else have any questions? And then I'm going to ask specifically whether Jill or Kevin have any questions.
I do not, Kimberly.
Thank you.
I don't.
Okay. All right. Anisha, thank you so much for coming to testify today. We really appreciate the information that you've given us, and I think we're going to move to our next person. That is going to be Kathy Nishimoto. Kathy, are you still with us?
I am. I hung up because I was losing audio, so I called in. So you won't see my face, which is probably a good thing. So I am going to talk from my notes. It will help me stay focused. First of all, for those that don't know me, I get emotionally involved with our staff. I actually love fighting for our employees, even when it's not popular to do. What I've heard today bothers me tremendously. I don't know you, but I feel your pain. So my name is Kathy Nishimoto. I speak today for myself and as the VP and COO of Duckwall Fruit and Hood River. I'm in charge of the human resources, safety, as well as the production and shipping areas. We've been working on COVID-19 policies and procedures since the 1st of February. As you are all aware, recommendations change rapidly, and depending on what agency you were following, a recommendation might be different. At that time, I was following the CDC, FDA, ODA, and OHA. Yes, that was my full-time job. Oregon OSHA requires employers to offer a safe and healthy workplace. So we started to implement multiple COVID-19 safety guards as the information became available. We had weekly staff updates asking them for help finding places that they feel were unsafe or needed changes. This is no different than what we do every month in our safety committee meetings. We treated this threat no differently than any other safety and our health threats that we face in the workplace. Since Duckwall is a fresh pear packer, we fall under the critical food infrastructure rules, which our employees are considered essential workers, so we continue to work. On May 26, 2020, I was notified at 6:07 a.m. via email that one of our employees who last worked on our swing shift, May 21st, had gone to the ER in the Dalles over the weekend and tested positive for COVID-19. Got to work at 6:45 and I looked at the current crew, and luckily, we had the crew working that had been off the prior week. We had successfully negotiated mid-contract with the Teamster Union to allow us to rotate crews out of seniority, which we had been doing since April 6th, so I was somewhat relieved. As soon as OSHA opened up, I talked to consultation, and with their thoughtful and careful guidance, we decided that the employee had not worked since the 21st, and because we are SQF, Safe Quality Food and USDA Food Safety Certified, which requires cleaning and sanitation of our lines each night we work, we had cleaned and sanitized twice since this employee last worked, and because we were on the rotating crew, it was safe to continue to work. We upped our touch point sanitizing, encouraged employees to mask up. However, it was still not recommended at that time, and our employees pushed back big time. I hired 2 more employees who do nothing but clean and sanitize for 8 hours on the day shift, 8 hours on the swing shift. We put up more barriers, laid down more 6-foot signs on the floor, took out tables, added more signage, closed down the vending machines, and which was the unpopular thing of all of this, I might add. That was Tuesday. Wednesday, we had 2 more employees from that same shift call and tell us that they had tested positive. During our daily COVID management meetings, we decided that we should shut down and call in a third-party company who we had on a retainer to come in and do a full plant cleaning and sanitizing, even on the opposite side of the plant where none of the employees from the packing line had gone. I recommended to our COVID team that we stay closed and COVID test all Duckwall employees, which we did, even though it was not required. We knew that we would lose orders, but we did it anyway. We shut down anyway as an overabundance of precaution, and because it was the right thing to do for our employees. It took 4 days at 3 different test sites to get all 246 employees tested. We even tested our contractors that we have on site. To my horror, 12 employees of the 246 tested positive, and they had no symptoms at all, nor were they related to the swing shift crew where our problem was. I have worked very closely with Hood River County Health Department and Dr. Van Telberg, who is the Hood River County lead physician, and kept saying to him that I could not understand how this could happen with all of our procedures that we had in place. Through the Hood River County contact tracing interviews of our positive and close contact employees, Dr. V told me that they learned that it likely was community spread, but that's all he would tell me. I wasn't satisfied. I am very close to our employees. So I asked a few who tested positive what had gone on outside of work time and found that there was a wedding and a barbecue that many of our employees attended. The reason I share that is Duckwall has done everything we possibly could to keep our employees safe. In fact, other houses toured our plant to see what we had done. I can't say that all 43 were community spread infected, but if this presumption was in place, all 43 employees would have been automatically a comp claim for Duckwall. Why do we have to change something that will hurt all employers to take care of a few bad acting employers? Employees have confidential avenues to file complaints anonymously against any employer they choose. They can call the ombudsman and get help, bully. Heck, they can even call the news to get something done. I'm sure that's how you heard about Duckwall. I am open to questions, but before that, I want to say that I was appalled when I listened to the audio from the 30th. Specifically, the question about wanting to know why we hadn't seen any claims from some of the outbreaks at the known ag employers. Maybe these low-paying workers are being otherwise coerced, filing a claim for fear of retaliation. First, as far as I know, from reading Governor Brown's letter, this has not been charged with deciding if employers of low-paid employees are coercing their employees not to file comp claims. Our job is to listen to the facts, review the data presented, and make the best recommendation that we can to the governor. Not lump all ag employers in the same bucket. We are not all trying to intimidate or retaliate if our employees file a claim. In fact, our employees have union representation. Our piece rate packers make $20 to $40 per hour. Our hourly make $13.50 and $35 per hour, depending on the job. Our 43 employees tested positive, and our employees who were close contacts received up to 80 hours pay at 100% wages versus 66 and 2/3 that they would have received if they filed a comp claim. Many decided to take a few more weeks off before they returned. They were able to file unemployment and receive an extra $600. Duckwall has even paid employees out of our own pocket to stay home when we found out that they had visited folks that had come in from outside the U.S., and we, quite frankly, were afraid. So they didn't lose any pay. It came out of our pocket. That is why you don't see any claims from our workers. Thank you.
Thank you, Kathy, for sharing your story with us today. Does anyone on the committee have any questions for Kathy?
For work.
Yes, Alan.
Yeah, thanks, Kathy. That was very hard for you to say, and I appreciate coming to the committee with one employer's perspective. It was really helpful. Thank you. And moving.
Do any other committee members have any questions? And I'm gonna see that I ask Kevin and Jill as well. Okay.
Thank you, Kathy.
Kathy, we really appreciate that perspective. It's good for us to, we know we've had several workers experience. It's great to have someone share with us their experiences as an employer. So, and it was clearly a difficult conversation, and I really appreciate you sharing today. I think we're going to move on to Jennifer Flood. I see Jennifer, so I know that she is still here. Jennifer, I think you folks had some questions, so I think you're coming prepared with information. Is that right?
I do have some information, correct, yes. So okay. Good morning, everyone. Jennifer Flood, Ombudsman for Injured Workers at Dcbs. From Tuesday's meeting, there was some questions that were being asked regarding what is our office actually hearing from workers, and if I had any data regarding that. Regarding the volume of complaints, we did not track them specific to COVID, but I will say our call volume overall is actually down, which isn't surprising with the loss of jobs that are out there. But the calls that we have received regarding COVID issues is basically those workers that will call and say, well, is this covered under workers' comp, and wanting to know about that process. And we've gone through that process of explaining their right to file. However, we share also the burden is on the worker to be able to, the burden is on them to prove that their exposure was at work. Many of them, their employers, as Kathy had stated, there are employers out there that have stepped up and are helping their employees, whether that be with paid leave, with ensuring a safe work environment, etc. But there are those many workers that are fearful of losing their jobs, whether that comes from their employer directly or just part of the work environment where that fear is out there. That's true prior to COVID as well as with COVID. Most of the complaints that we have received are from those workers that had regular claims, non-COVID claims, with the difficulty in seeking medical services, treatments, or surgeries being delayed, etc. Which I know that's not what we're here to talk about today, so I won't get into those issues and how we've helped overcome some of those. That's not on. Not sure who that is. Not here. No little ones here. So that's on the volume of claims and the calls that are coming in. There is the concern regarding safety in the workplace and proper PPE. We've worked with Oregon OSHA. I know that there are folks that in the beginning might not have been able to get through or didn't feel that they were being heard. But my understanding from our experience with that, and I'm sure Michael Wood could probably share more information about their process with those workplace safety concerns. But they are going through those issues. Some of the specific employers that may have been mentioned or may not have been mentioned in earlier testimony have all been a part of that, I believe, or not all, but a good portion of them. The issue of the daunting, got to prove that you were exposed at work, is pretty high. As I had shared, we do explain every worker has the right to file a claim. I do want you to be mindful. I know that you received the education from Workers' Compensation Division, just the overview regarding the workers' comp system, and attention that was brought to the timeliness and the timely filing of a claim. From our office perspective, we beg people to not self-filter that. I encourage employers, please don't tell a worker you don't have the right to file because it's more than 90 days old. Let your insurer make those decisions. An insurance company can deny a claim based on that timely issue, but for a worker or an employer or a medical provider to say, oh, it's beyond 90 days, so we're not going to file a claim, is problematic from my perspective. And although we do encourage the filing of a claim, like I said, some folks are like, well, my employer is saying they're going to take care of it. My employer is going to pay for the testing of it. That's all good and well, but I do believe that that's probably a good portion as to why claims aren't filed. Those workers might have an employer like Kathy had mentioned, where they are taking care of their people. Unfortunately, there are a lot of businesses out there, large and small, that don't, or may not directly say, you're not filing, but there is that fear factor, or the fact that they might file or threaten to file, and then they don't have a job. With those calls that do come to us, again, it's the worker's right whether or not they want to pursue it or not. Many of them decide not to pursue it because they are beat up, they are emotional, they don't want to go through that process. One of the things about presumption, and I'm not going to get into all the stuff that we're not supposed to get into today, but that presumption, I believe, would take away some of that concern and that burden from the worker, but it would also provide that protection to those employers for that exclusive remedy. And I feel that it could heighten the awareness of making sure that our workers are in a safe work environment out there. Without any kind of accountability for that, you're not going to have your employers like Kathy's that are stepping up and doing it because it's the right thing to do. Some employers do require that. So along that line. So on the education piece,
we have to give everybody the same opportunity, and that's we appreciate your perspective, but let's have that discussion at a later date if that's okay.
Exactly. Yep, totally. And so on the education, I did have some stuff on that too, but that's more along the lines as to how we can go about doing that. So I'm assuming that that's probably for a later date. That was a question.
We did have discussions about education. I think that's, I think that's on the table right now as well. That's not I guess I don't.
Okay. Yeah.
I don't necessarily see that. I mean, I think that's, well, I guess it is probably, you're right, that is sort of one of the ways that you're addressing it. So maybe we should table it just so that we're tabling all of that. Let's talk about that when we get to that stage, and please do come back and share your perspective. You certainly have a perspective that none of the rest of us have, right? So we really value your input. I want to make sure folks get an opportunity to ask questions. Committee members, does anybody have any questions for Jennifer? I'm not seeing, I see a kitty in the background, but I'm not seeing any questions. I just want to make sure Kevin and Jill have an opportunity if they would like to ask questions. I'm not hearing any. I think we're going to move forward. Jennifer, thank you so much. I know that we'll have you back to share more with us in the future.
You bet. Okay, thanks.
Okay, we are going to move on to Cena Wittenberg. Cena, are you around today?
Yep, I'm definitely around. Can you hear me?
Yes, thank you. Appreciate you.
Hi. Good to see everyone. For the record, my name is Cena Wittenberg, and I'm here today on behalf of the Special Districts Association of Oregon. Special Districts Association of Oregon, and I want to specifically speak to the agenda item that says identify problems or gaps in the workers' compensation system relative to COVID-19. And before I say anything else, I would just like to say that our association does not see any gaps in the workers' compensation system. Our association has 950 members statewide, and 60% of those members get their workers' compensation coverage through a self-insured pool that we operate. We have, and our largest number of members in that pool are rural fire protection districts. We have 200 rural fire protection districts that we provide workers' compensation coverage to, and from our perspective, the system is functioning really well. We haven't seen a huge problem with claims. We haven't seen a lot. We haven't denied many. We have had. Let's see, this information is current as of the end of June 30th. We had 24 claims that were filed. Of those, 5 involved fire districts, and 1 of them involved a transit district. And we accepted 23 of those 24 claims. We don't require you to test positive before we accept a claim. We denied 1 claim, and I feel like we ought to tell why we denied the claim, and it was because the medical professional that this claimant had indicated that they didn't have COVID-19, they had the flu. And so we denied the claim, and nothing else has transpired so far. We do pay for quarantine because we pay interim time loss on any claim that's submitted where there's a medical authorization for disability. And that time loss continues until the worker is released back to regular duty or the claim has been denied. So our people don't seem to be having a serious problem with intimidation, the ability to file a claim. We're accepting claims and things are proceeding in the normal workers' compensation fashion that we have seen on other issues. So I have written testimony in the record and I won't take up any more time. Thanks.
Cena, thank you for coming today. We really appreciate it. Do any committee members have any questions for Cena? I'm not seeing anyone raise their hand. I'm going to ask whether Kevin or Jill has any questions.
Hey, Kimberly, I do not.
Thank you.
No, I do not. Thank you.
Thank you. Cena, I really appreciate you coming today and sharing and submitting the written testimony. I think we will move on to our next presenters. That would be Kathy Gehring and Holly Odell. Good morning.
Good morning. Can you hear me?
Yes.
Okay, great. So my name is Kathy Gehring. I'm the Vice President of the Claims Division for State Corporation. And I did provide written testimony, but I do want to run through that, and please feel free to ask any questions along the way. Before I get started, I did want to express my appreciation for everyone that has testified so far. I know that that can be a really difficult thing to do. So wanted to acknowledge that. And then also want to take the time to say thank you to the committee members for diving into the workers' compensation system's response to the coronavirus. SAFE wants to provide our understanding of coverage for COVID-19 under existing Oregon law, our approach to processing claims, and our detailed claims data. Today, we are working on listening to the testimony that's already been presented and the additional testimony after us to identify any problems and gaps in the system. And we'll work with MLAC and stakeholders to brainstorm solutions to address those identified problems. SAFE is committed to making benefits easy to access and ensuring that workers who are injured or experience illness at work get the benefits that they deserve. And while SAFE insures more than 54% of Oregon businesses, we can only speak to our own experiences related to coverage, claims processing, and data. In Oregon, COVID-19 is a covered condition when it's work-related. SAFE treats COVID-19 as an injury, not a disease, because the exposure and subsequent onset of the condition occurs during a discrete period, and because this creates an accessible material cause standard when addressing the compensability of a claim. SAFE accepts both claims for exposure and for illness. In processing these claims, we seek to determine if the exposure occurred at work and applying learnings from public health authorities about transmission. For workers who come in contact with an infected customer or patient at work, SAFE generally accepts the claim and pays benefits. Workers' comp benefits in Oregon are quite robust, and payments can include time loss for quarantine or time off sick, diagnostic and treatment-related medical services, permanent disability, and in the event of a fatality, payments to beneficiaries. For workers with no known work exposure to someone sick or with a primary off-work exposure, we do seek additional information from the employer and from the worker, and will sometimes request a medical opinion to learn the likely cause of that condition. If it appears the transmission occurred at work, we accept the claim and pay benefits. Overall, where the laws and rules are silent or permissive, we're making decisions that favor the worker. It is interesting to note that our standard practice goes beyond even some of the presumptions already established in other states. So about our data, as of last Friday, we have received 553 COVID-related workers' compensation claims. Just over 90% of those are from healthcare and residential care workers, while a little over 4% are from first responders. 30 claims in total came from all other industries combined. Some of these claims are exposure-only claims made by workers who are still healthy. One trend we're seeing now is repeat quarantine-only claims from workers where policyholders have asked their employees to quarantine due to a known exposure, but they don't test those workers. For symptomatic workers, we're finding that most have access to testing now, which is different than what we saw at the beginning, with improvements in testing availability. About 2/3 of the workers who have filed claims with us were tested, and about 1/4 of those workers tested positive. So of the COVID-19 claims that have been processed at SAFE, we have accepted 87% and we've denied 13% of those. The denied claims are primarily for workers that had no known exposure at work and did not have a positive test. We have denied 4 claims for workers who tested positive. So I'll talk about those just a little. One was exposed in the home to a known positive individual and became symptomatic 2 days prior to the first claimed work-related exposure. The second claim also lived with an individual who was ill for some time before he became symptomatic, and the worker was actually contacted by public health authorities through contact tracing to notify him of that exposure. The last 2 claims that where we denied for when a positive test took place were for workers who did not have a known work exposure to a positive COVID-19 source. Often we're paying time loss or medical benefits in denied claims. We've now paid benefits in 70% of denied COVID-19 claims. So far, our workers and policyholders have understood SAFE's claim decisions, and we currently have no pending appeals or disputes. We do understand that there's questions about why we haven't seen more claims than we have, especially in non-health care workplaces like food processors or agriculture, as Kathy mentioned previously. When we learn about a workplace outbreak at one of our policyholders, we usually reach out to make sure the employer knows that COVID-19 is a covered condition if work-related, and to see if there are any claims that should be filed. When claims haven't been filed, most often there's a key factor that causes employees to tie their conditions to off-work exposure and not to work, like a group of workers becoming ill before they came to the workplace. Sometimes policyholders do share with us they are covering benefits for quarantine or exposure-only claims with other leave types, such as federal sick leave. We do ask employers to help educate workers so that work-related conditions are treated appropriately. And in closing, I just want to state that we do take our mandate to serve workers and policyholders during this time very seriously. We would be happy to share any additional information and experiences that may help this committee in your efforts. I thank you for your time. Holly O'Dell is also on the call, and so either one of us are happy to answer any questions that you might have.
Well, I don't see any. Okay, so I see Diana. Go ahead, Diana.
Thank you guys for being here and providing the information that you have. I do have 2 questions. Just to clarify, your choice to cover those denied claims, is that something that you feel statutorily that you're required to do or not?
When you say cover the denied claims, you're referring to the benefits that we've paid in those claims?
Yes.
So oftentimes what we're seeing is in those situations, the time off of work is around that quarantine time frame. So you're looking at a up to 14-day period, and we're paying interim compensation because the claim is in deferred status while we are moving through to make the decision, gathering information to make the decision on the claim. And so we are paying the time loss for that quarantine period, and we usually see that worker go back to work within that time frame. From a medical perspective, what we're seeing most often in those claims is if a worker gets a test, we still haven't received bills for testing. We would pay that if we got the bill, we just haven't received those. And we are also paying if they do have an office visit, so we might pay that bill. But we have not seen benefit needs beyond that. So that kind of covers the details of the benefits we're paying and why.
I guess maybe I should try to ask that a little differently. What I'm trying to sort of illustrate is the fact that, and we've seen this commonly, is that SAFE is generally a pretty good actor. I guess I'm just trying to determine whether or not what you're doing you think is required by everyone who's an insurer in Oregon.
So everyone is required to pay interim time loss while the claim is in a deferred status if there's authorization to be off work. We consider quarantine by a medical director or public health authority to be that authorization. So with that in mind, that would be something that all would need to pay with that interpretation.
And another question along those lines is, are you aware of any other insurers that are doing the same process of reaching out to employers when there is a known COVID case?
I'm not aware of that. It doesn't mean it's not happening, but I have not been told that.
I think to the co-chair's question, there's probably 3 categories of benefits. One category might be one that would be required to be paid by statute very clearly in any circumstance. And a second might be benefits that are could be interpreted as being required to be paid under statute, given a liberal and worker-friendly interpretation of the law. And the third would be kind of voluntary benefits that would not be required to pay under statute. And just for the record, this is Holly Odell, Vice President of Legal and Strategy at SAFE. So SAFE is acting in all 3 of those categories. Like Kathy said, we are paying interim time loss while the decision is made on the claim. And when that's authorized by the worker's doctor with a time loss release that's specific to that worker, it's mandated by statute that SAFE and all carriers pay those benefits. And then in that second category, SAFE is interpreting quite liberally and in favor of workers whenever possible, all of the statutes and rules. And an example of that would be when the worker has a mandate to stay at home from their employer, who might be a healthcare provider, but they don't necessarily have maybe an authorization for time loss with their name on it. That's releasing them in particular to stay home. And SAFE would interpret the time loss release requirement very liberally and would accept the mandate in an employee policy manual at a healthcare provider, for example, that the worker quarantine as sufficient to trigger time loss. So that's that second category where SAFE is interpreting a statutory requirement as liberally as possible and going ahead and paying the benefit. And then there's that third category of benefits that the carriers are not required to pay for under any interpretation of the statute and the rule. And that would be things like Kathy mentioned for testing or medical treatment in a claim that maybe was denied. Maybe it turns out the worker had the flu and tested negative. And SAFE would still go ahead and pay for that often if we were to be billed for it, if we began to be billed for testing. And we do those voluntary payments of benefits sometimes where it's clearly not required by statute or by rule to facilitate workers getting the test that they need, to facilitate finding out what's really wrong with that worker, to make sure that people are taking themselves off the job when they're sick and filing the claims when appropriate. And so SAFE is acting in all 3 of those categories, and we can help in response to questions clarify when it's our understanding that all carriers would be required to act in those ways.
Yes, Diane?
I just wanted to say thank you, Holly, for answering the question that I was attempting to ask. And again, thank you guys for your liberal and worker-friendly process. I do think that this also helps us understand a potential gap area in the sense that there's a lot of discretion for interpretation that may be creating some issues and leaving people out of the system. So thank you.
The standard for compensability is probably very similar, where the way in which we're interpreting how these claims should be determined in terms of an acceptance or denial also could likely fall into those same 3 categories about areas where the statute and the rules are really clear, places we're interpreting more liberally, and then places where we're taking voluntary action because coronavirus is so unique. And so in the way that we would decide if a claim should be accepted or denied, one decision that SAFE made that Kathy referenced in the testimony is to interpret the law liberally and assess coronavirus always as an injury. So that means that there's a much lower standard of compensability, that the workplace need only be a material cause, not the major cause. And then another thing that SAFE did when we interpreted the statutes and rules liberally is we interpret that if the person is exposed and experiences some time off, but then tests negative, instead of paying the interim time loss and then issuing a denial, SAFE pays the interim time loss and then issues an acceptance for exposure. So we've applied a liberal interpretation so that exposure can be a compensable claim. And then in addition to the doctor interpretation of what is time loss, SAFE also helps facilitate the medical opinion so that the doctor is asked when appropriate where the condition occurred, instead of waiting for the worker to prove where the condition occurred. So if it's unclear to SAFE whether the worker was exposed at work or at home, we'll ask additional questions and do more investigation. And when we need to, we're going to get medical opinions so we can understand where the exposure occurred, and aren't waiting for the worker to bring forward some kind of proof that it was here or there. We're considering that as part of our obligations in processing the claim in a reasonable way. And so there's those three pieces. Mm-hmm.
Holly, I hate to interrupt. We're running a little late and we still have quite a few. I don't want to cut you short because you do have fantastic information, but I'm going to give you one more minute and then we got to wrap up so we can move on to some of the other people that have come today to testify. I'm so sorry.
Thank you for your valuable time. Yes, so those are the three on compensability, is that we accept claims for exposure. We use the injury material cause standard, and we help find out where the worker was likely exposed, and don't wait for the worker to bring some kind of proof of where they were exposed. Thank you.
So I thank SAFE very much for coming and meeting. Is it me that's having delay? Because I can see all of you moving very slowly.
Kimberly, we're experiencing it here as well.
Okay, good. I thought it was maybe just me. So I do hope that we can have SAFE come back so that they are taking part in, and maybe this is something you guys could be thinking about in the interim. When we do talk about resolutions, we would very much like to see what's in more detail, what the types of things that SAFE is doing, so that maybe we could look at whether that's something that could be required for others. So as we move forward, please keep that in mind. We will be looking to you guys to help us with some of those solutions, because it sounds like you guys are doing the right thing, and we'd like to see everybody do the right thing. So thank you guys for coming today.
Thank you.
Yes, I'm going to move on to Katie Sussman. Is Katie still on the line?
I am. It's Kate Sussman. Can you hear me?
Oh, yes, and I apologize, Kate. It is Kate. It's not Katie. So please go ahead.
Thank you. Good morning. Again, I'm Kate Sussman for the record. I'm an attorney at the Northwest Workers Justice Project in Portland. We're a nonprofit law firm, and we help low-wage workers, mostly immigrants, in employment matters. We don't do workers' comp law, but we do workers' comp retaliation, and I've litigated quite a few of those type of claims. Broadly, when we deal with the workers' comp system on behalf of our clients, we see that it is hard for workers to prove their workplace, that their injury was a workplace one. They're told things like, you had an underlying condition like arthritis. Even if you're doing a manual job that's repetitive and to me, clearly related. And that's even more true if it's a infectious disease or occupational disease. I looked at data. We reviewed a bunch of data from the Dcbs on claims, COVID-related claims filed through June 22nd of this year. And it just seems, it's very apparent that a lot of claims are not being filed. I'll submit that data for you all to review as well. But of the 441 claims that were included in that batch from June 22nd, 126 were denied. That's about a 28.6 denial rate. These are not inclusive of accepted non-disabling claims. I just want to put that out there. So these are disabling claims. And of those claims, of the 441, the vast majority was healthcare nursing home claims. There were about 37 that I could clearly identify as non-healthcare or nursing homes. And there, the denial rate was 73%. I want to contrast that with the health report that OHA puts out every week. And that indicates that about 60% of the workplace infections are happening in agriculture and food processing. So these are the cases we've heard about: Pacific Seafood, Townsend Farms, Duckwall, and others. That number does include household members and other close contacts, so it may not be all workers, but still we know that the outbreaks are happening in food processing. Yet only 2 food processing workers have made workers' comp claims that we can identify. Both were denied. No agricultural workers. There was one claim at Bob's Red Mill that was accepted. So there's something going on there where you look at the huge number of workplace outbreaks in food processing, specifically in the 2 claims that have been filed. 3 rather, if you include the Bob's Red Mill. I know there's the lag. We've heard about the 75-day lag. But even in the resolved cases, you're seeing about half of the reported cases are in food processing and agriculture. Also, just a quick anecdote, we started hearing from Townsend Farms workers in early May, and they were talking about an April outbreak. That was 70 days ago, and there's no claims, no Townsend Farms claims filed that we can see. Again, these would be disabling claims. And I know we're short for time, but I just want to briefly talk about the retaliation fears that our clients experience. And there's a bunch of reasons that I think these claims aren't being filed and that these claims are missing and otherwise should be in the system. The retaliation that our workers, many of whom are immigrants again, feel is very real. Even if they go through the comp system, they're often told at the end, there's no more work for you. And that's a quote. We hear it over and over. There's no more work for you. When they go back to work after their injury, those are the cases we end up taking. Also, a lot of settlement agreements involve giving up your job, which just seems against public policy and against what workers' comp is supposed to do. Workers are afraid to lose income. We know that. We've heard many stories, especially of farm workers who do this intense seasonal kind of work, that are very afraid to lose that income, lose that job eventually. There's one other issue I want to mention, which is a lot of our clients receive health care in federally funded clinics, which do not provide workers' comp. So they have to switch over to a new healthcare setting, which means giving up a trusted and usually culturally competent medical care. And just finally, I know I said one more issue around retaliation, but there's also a lack of education, I think, from certain employers that it's their responsibility to file those claims and to have a system that works for their workers to learn about the comp benefits they have and to get those claims filed. But we hear over and over employers telling employees not to file or say their injury is non-work related or not to go to the doctor at all if they're hurt at work. So we're strongly in favor of the rebuttable presumption. Want to stress it's rebuttable. So in the situation that Duck talked about, they would rebut that with, well, there was a big party. We think folks weren't on the line, etc. And retaliation protections need. Yes.
We're going to table the discussion about the presumption. I appreciate, and we do definitely want you to come back when we're going to have those discussions. Right now, we really want to focus on the issues, and I think you've identified quite a few, and I appreciate that. But we're going to table the discussion about solutions until we've gone through our analysis of of the issues. So if you had anything further on that, please feel free to share that.
Kimberly,
No, that was the end. Thank you.
This is Kathy. I do have one question, though. Did you happen to ask the employees if they received FCRA for the first 80 hours?
The employees from Townsend, are you saying?
Well, any of the employees that say that they weren't compensated. Just curious.
Well, we certainly, there's a lot of confidentiality and things I can't discuss, but we certainly always make sure workers are aware of the coverage, either from the FCRA or from state sick and other issues.
So it's possible they didn't file a claim because they got FCRA.
Possible.
Yeah, thank you.
Okay, did any other, Tammy, go ahead.
Kate, I think you said that 73% of the claims filed at the nursing homes were denied. Do you know in those 73% the reason for the denial?
If I said in the nursing homes, I was talking about the non-healthcare setting claims having that really high denial rate. And there is some information in the data we received, but it's not, there's no one answer why claims were denied. And no, we don't have the sort of, I wouldn't be able to say this is why it was denied. But I'll submit that after after the meeting.
Yeah, if you have that, that would be really important to know. My claims adjuster who I spoke to had 25 COVID claims filed, and 24 of the people tested negative for COVID. So out of the 25 claims, he accepted one and he denied 24. So it sounds bad, but there was 24 negative tests. They didn't actually even have COVID. So I'm wondering this high percentage of denials, if some of it is stemming from that. So yeah, if there's any data on that, that would be great to see.
Yeah.
Okay, I'm trying to keep us on track here. So I'm not sure where the noise is coming from. Okay, perfect. I'm guessing that maybe Teresa helped us with that. Kate, thank you so much for testifying today. We really appreciate it. It helps us understand from your perspective what you're seeing workers have concerns about. So thank you very much. We appreciate that. I think we're going to move to Christina Stevenson, and I see Christina is with us here. So Christina, please go ahead.
Thank you. Thank you for the members of the committee for taking the time. My name is Christina Stevenson, and I'm an attorney that represents workers in employment discrimination matters. So about 30% of my practice is representing people that have been retaliated against for filing workers' compensation claims. And an additional 20% of my practice is representing people that have been retaliated against for reporting that their workplace is unsafe. As you've heard today, there are existing gaps in the workers' compensation system that are only compounded with the public health crisis. Workers are facing retaliation for reporting unsafe working conditions. They're being discouraged from filing and then retaliated against if they do file. You've heard from several workers today, and I want to emphasize that in my experience, these accounts are not anecdotal. They are representative of what I have seen in all types of workplaces. So you heard from Anisha Yurchak, for example, who described the systemic suppression of information to workers, which then in turn puts the rest of the public at risk. The workers need to be educated about filing workers' compensation claims. Employers routinely intimidate workers out of filing claims, fail to notify workers that they may be eligible to file. And as the nurse that testified earlier said, it was an outside doctor that identified the claim as a potential claim, even though she'd spoken with numerous people within her employer system. And I regularly see that the only people who identify the possible claim as workers' compensation related are folks outside of the employer. So there's not currently an effective mechanism to shift the internal incentives within the workplace to make it so that work injuries are reported completely. I think that both sides need to have a better understanding of their rights and responsibilities. And the COVID outbreak just simply shines a brighter light on the existing gaps in the workers' compensation system. And when we're dealing with public health crisis, that just illuminates how much more important it is to have workers swiftly get the medical attention they need so that it stems the spread both in the workplace and in the rest of the community. Thank you.
Thank you, Christina. Does any committee members have any questions?
I do.
Let's start with Tammy, and then I'll move on.
Okay. Hi, Kate. I think it was Anisha that talked about several employees were fired after they had filed a workers' compensation claim. And fortunately, I've never dealt with anything like that. I don't know the rules, and so is that a BOLI suit? Is that in the workers' compensation division? Can you kind of educate me just a little bit on their recourse?
Sure. So employees can file a complaint with BOLI, or they can file a civil lawsuit right now for that sort of retaliation. But what we've seen is that there are gaps in that system that make it difficult for all sorts of the misconduct that we see related to the workers' compensation to be redressed. But generally, those are the two processes.
Thank you.
I believe that Kevin also had a question. Is that right, Kevin?
Yes, thank you, Kimberly. Christina, thank you for coming and sharing this information with us. I have a question. I'm going to try to work through this, so bear with me and try to hear the question I'm actually asking here. But we've heard some testimony that it's very potential and likely there are some employers that are going above and beyond, that are paying, taking care of the test, taking care of all of that, so claims are not being filed. Or just recently we heard testimony that it is possible that if it was claimed by CIPRA and went through CIPRA, then a claim wouldn't be filed. I guess my question is, if that happens and the claims aren't filed, 10 years down the road, we've learned a lot more about COVID, maybe even 20 years, and all of a sudden, what do those employees that haven't filed that claim, what's their recompense? How do they deal with that? What are their rights? Or if they signed them all the way by not filing the claim?
I think that's a great question, and I would defer to my colleagues that actually do work in the workers' compensation system. But generally, I think that it is likely that an employee who gives up their workers' compensation claim in the first instance is going to find it very hard down the road once they see manifestations of that injury come up later on to be able to open a new claim.
Thank you very much, Christina, and thank you for hearing the question I was trying to ask.
Diana, go ahead.
Thank you for Christina for being here. When it comes to the retaliation cases, if a worker is successful, what does that look like in terms of the penalty to the employer?
That's a great question. Right now, there are the main mechanisms within the law are related to employee compensation for the harm rather than employer penalty for the harm, which is just a little bit different philosophical approach. It is, there is some potential for some claims to have punitive damages, but the way that the system is set up right now, a lot of the really systemic issues like the incentive to not allow employees to report in the first instance, that does not have an effective enforcement mechanism or any real sort of penalty in the law right now.
Atusa, I know that you raised your hand. Go ahead.
Christina, you said that some of the testimony that we received earlier is kind of representational of experience, kind of broader experience, I think, in the system. Could you speak to that, if you know, maybe the impacts that kind of experience has on workers who, go to a different employer, who may handle, maybe they do show up at an employer who is quote unquote a good actor, but they've had this previous bad experience. How does that impact their experience in the future or across the system, if you know?
That's a great question. I think that once an employee has been in a system where all of the messages are, do not file a workers' comp claim at any cost, we'll divert you to any kind of system that will make sure that you do not file a claim, that employee believes that is the incentive at all employers and is chilled from bringing a claim going forward at their next employer.
Thank you.
Go ahead, Tammy.
I just want to apologize, Christina, for calling you Kate. That was the prior speaker. I've got all my notes about everybody's testimony, and sorry I got that a little mixed up.
No problem.
Are there any other questions for Christina? We're down to about 15 minutes. We still have 4 individuals on the list. I think we're not going to be able to get to everybody. And so we're going to have to roll some folks over. But if nobody has any further questions for Christina, we're going to thank her today for her testimony. And I think we are going to move to Jess. And I know I'm going to get your last name wrong, Jess. As hard as I try, I'm just not going to get it right. So we know who you are. And maybe you'll tell me how to say it correctly.
Thanks, Co-Chair Wood. Genatino Villatoro. Co-chairs, members of the committee, thanks for the opportunity to testify today. My name is Jess Genatino Villatoro, and I'm the political director at the Oregon AFL-CIO. The Oregon AFL-CIO represents 300,000 workers across the state and is a voice for all workers in the administrative and legislative process. This Oregon's frontline workers have been asked to continue to provide critical services across the state during this unprecedented public health and economic crisis. That service looks like the workers who we typically think of when discussing frontline workers, like nurses and firefighters and educators, but it also includes grocery workers, food service workers, agricultural workers, and state employees. These workers have been exposed regularly to the coronavirus at work. To highlight some of the reasons why we are coming to you today, why we think a rebuttable presumption is needed, a cursory review of the Dcbs data that was submitted to the record today by Kate shows that Providence had only 3 accepted COVID-19 related claims and denied 38. That's an acceptance rate of 0.07% for frontline healthcare workers. And I just want to take a minute to address Tammy's earlier question about folks testing negative, and that's why the claims were denied. Right now, according to the CDC, there is now a 30% false negative rate, and that we know was much higher earlier in the outbreak. Though this data did not include accepted non-disabling claims, Providence is a clear outlier among healthcare providers for an incredibly high denial rate. Additionally, we've clearly heard from worker testimony today that employers who are not the comp system are advising that employees don't file a comp claim and instead file a leave of absence or use their own paper. Excuse me. In addition, these denials are happening so quickly that one can only deduce that some insurers are deflecting their responsibility to determine whether or not the contraction occurred at work, and instead relying on the lack of a rebuttable presumption and denying these claims based on a communicable disease standard. As the members discussed at the June 30th MLAC meeting, it will be critical to both analyze the presumption 17 other states have enacted by executive order or legislatively, but also to analyze each of those state shutdown orders. Governor Brown chose to not designate essential workers, unlike other states, and instead close select businesses like bowling alleys and give general guidance to other employers that chose to remain open. And as you heard this morning from worker testimony, that guidance has proved largely unenforceable. This means that Oregon had more workplace exposures at the initial onset of the virus than other states. And any policy decisions that MLAC suggests should be reflective of that policy choice. To enact a narrow rebuttable presumption that doesn't reflect the vast number of workers exposed would be inconsistent policy and unfairly disadvantage Oregon's frontline workers. Additionally, there are several issues with the 801 form that need to be addressed to ensure equal access and data transparency into Oregon's workers' compensation system. We would respectfully ask this committee to review the necessity of providing a social security number on the 801 form. Undocumented immigrants are allowed to draw workers' comp in Oregon, and to require a social security number on the initial form that's completed to access the benefit is contradictory to the value statement of access to begin with and can create a chilling effect to filing. Additionally, we're seeing incredible disparities among Black, Indigenous, and people of color workers contracting the virus, especially in industries that are disproportionately made up of communities of color, as Kate highlighted, food processing and agriculture. And she also mentioned that there are only 2 claims from food processors, both of which have been denied. Additionally, according to a recent report that I think was flagged at the June 30th meeting from the National Employment Law Project, we know that Black workers are twice as likely to have concerns about workplace exposure to COVID-19 compared to white workers, with 39% of them reporting that they were not satisfied with the employer's response or did not raise it for fear of retaliation. We would also ask this committee to explore adding a race and ethnicity box or whatever is appropriate on the 801 form to ensure that we can track which communities are filing claims initially. MLAC has been tasked to review both presumption and worker education related to COVID-19. And we would encourage you to think about the education bucket in a holistic way. Yep.
Yes, you're getting into some of the solutions, and I'm going to ask you to stop. We have some more people. I'd love to squeeze some more people in so we can identify the issues. And I hear what you're saying, and I want you to come back to talk to us about the solutions, because I think you're identifying some good ones. But if you don't mind, let's stick to just our issues today. I know that's hard to do for it's so hard because it feels like it's all one thing, but if we can focus on that, that'd be great. I'm going to get you another 1 minute to wrap up, and then we're going to see if we can potentially have one more speaker come in. So please.
Sure. I'll just flag a couple issues. So we know that protections in Oregon's workers' compensation statutes regarding retaliation and coercion aren't sufficient, as we've heard from workers, and we've heard from Christina talk to some of the statutory gaps. But I do just want to point out one that we see as problematic and occurring with workers. The discrimination language in ORS 659A040 is only applied to hiring, tenure, or conditions of employment. If you contrast that with actual discrimination protections for all employment in ORS 659A030, it is starkly more narrow. And we see those types of discrimination playing out in all kinds of workplaces. And then I would just also flag that a current hole that we see is that workers' comp discrimination protections only apply to employers with 6 or more employees. And, I think from our perspective, there's no place for employer thresholds in Oregon's discrimination statutes. So I'll stop there. Thanks for all the work that you do to ensure that Oregon's workers' compensation system meets the needs of employers, and we look forward to future conversations on the matters discussed today.
Thank you, Jess. So I have one question for you, because the last thing that you talked about was piqued my interest, especially it's the first time I've heard that brought up. So I don't want to talk about a fix, but is that a workers' comp solution, or is that a fix that needs to occur with the discrimination laws? I just want to make sure we're doing the right things.
Yeah, so it is workers' comp. So OR 659A040 is unlawful employment discrimination against injured workers. The typical discrimination statute for employment is 659A030, and the protections granted in 040, which is the workers' compensation or injured workers discrimination protection, is far narrower.
So I'm going to ask, I have an ask of you, and that would be that you come back to us when we're ready to talk about solutions. I really want to hear more about that, and I want to have a better understanding and some suggestions on what that might look like. So not having a narrower interpretation here in workers' comp versus in other areas. So I definitely thank you for bringing that forward. I want to quickly. I think we're not going to make it to the remainder, but I want to offer our committee members some opportunities to ask questions. I see Alan has raised his hand, so Alan, go ahead.
Yeah, quick question, Jess. You mentioned that 7% of the Providence healthcare workers' claims are accepted. What was the reason for denying the other 93%?
The data set that we have from DCBS doesn't include much information on why they were denied. I think what we heard on the June 30th meeting, I'm far less of a workers' comp expert than you all, is that we would need the denial letters to be able to tell a bigger story. So right now, we can't conclude one, but I do just want to highlight the false negative tests that we know exist, and especially in the earlier days, the rate was even higher.
And so so it's possible that they were people who tested negative, but whether false negative or not, we don't really know it either. So.
Yeah, I think that's true, but I would also highlight that Providence's denial rates far exceeded other healthcare providers.
That's a good point. Thank you so much.
Kimberly, this is Kathy. I want to clarify something, if I may. On the 801, under the DCBS handout, a guide to workers recently injured or hurt on the job, number 440-3283, at the bottom in bold, employees do not have to put their social security number on the form 801 and 827. I just wanted that cleared up.
Go ahead, Jess.
Yeah, I really appreciate that. I think our interactions with undocumented workers, and Kate and other folks can speak to this probably better than I can, is that just the mere appearance that it is required that they have a social security number, it provides a significant chilling effect, even if further in the form it says that you don't have to provide them.
But where is it required? Help me understand that.
I think that if you are a worker who is undocumented and you see a box at the top of the form that asks for a social security number that you don't have, it is hard to move forward in that process. And I think that is an experience that I have had working with undocumented workers, and that other folks can probably talk to more clearly. Even if it is not required, the mere presence of the request is scary. Because frankly, if just a Immigration 101 for 2 seconds, if you provide a false social security number, you can never become a citizen. So there are significant negative ramifications for comporting to a system that doesn't currently apply to you.
Jess, thank you for that. I have a question, and that would be, is it statutorily required that it be on the form? I'm not sure what the purpose of the social security number on the form is, so I'm just wondering if maybe that's something that I think DCBS may be able to help us with, to help us understand why it's on the form and whether it has to be on the form. And then that would be really helpful if we could get that information. I want to make sure we have 2 minutes left today, and I know we're gonna try to stop at 10. Diana had a question first, and then Tammy.
I was just going to ask that while we're asking things of the division, if my audio was not great during Justin's presentation, so I did miss some of the information regarding the differences between the discrimination, and if we could have DCBS work some of that up for us and give us what information is available, because obviously I think we all have some concern about how that's operating in this situation, and it'd be good to talk about it more knowledgeably. So thank you.
Yes, and I'm hoping that that we can also get from DCBS the minutes, because that will help. Like you, I missed some pieces and was straining to hear what Jess was saying, so I'm hoping that DCBS might be able to give us our minutes by the next meeting. I know that's a tall order, and I apologize, but it would be certainly helpful for us as we go into the next meeting. Tammy, go ahead.
I see that Michael Wood is on here from Oregon OSHA. And I'm wondering if maybe at one of our next presentations, Michael could speak or talk to us, because we had several workers talk about OSHA issues and issues with OSHA that are coming into workers' comp and instead of the OSHA. So I'm hoping that Michael Wood would be willing to talk next time. Is that possible, Michael?
Would be happy to do that. And I got called away a couple times, but I've heard most of the concerns raised, and I'm sure Teresa will make sure to fill me in on anything that I didn't.
Okay. Thank you.
Does anyone else have questions for Jess before we move past or move on? Okay, it looks like, and I want to make sure I'm mindful of Kevin, Jill, or Kathy. Any further questions?
Not I.
Okay, well, we are at 10 o'clock and we had a 10 o'clock deadline. We are going to hold to that today. Thank you, Jess. Thank you, everyone who came to testify. We really appreciate it. We know that today was emotional for some people, and for myself, I just want to say thank you so much. I know that that has got to be difficult for you to come and share with us some of what was shared today. And from the bottom of my heart, I really appreciate each and every person who took the time today to share with us and help us understand their experiences. And we hope that that those who haven't had an opportunity to talk, we're going to put them at the top of the Tuesday meeting so that for sure you're able to get time to talk. We are still taking testimony on the issues. We are reaching out to carriers, and I know that hopefully we'll have some carriers come to share where they're at, because I know we got to hear from SAFE, but not some of the other carriers, and I think that, and self-insured, and that's where some of the concerns lie. So we're hopeful that we're going to have those at the next 2 meetings to help share with us what they're doing. And stay with us. Please come back and join us when we move to the next phase, which is going to be talking about resolutions. So thank you guys, everyone, for coming today, and hopefully we'll see you on Tuesday. Thanks.